Waterloo.
Thank you very much, Mr. Speaker. My question is to the Acting Premier. Acting Premier, paramedics in Waterloo Region are struggling. Because of offloading delays at local hospitals, ambulances are taken off the road as paramedics wait for their patients to be transferred. This year, the Waterloo Region Paramedic Services has seen a rise in both code yellows, where there are 3 or fewer local ambulances on the road, and code reds, where there are no local ambulances on the road, none. Mr. Speaker, ambulances are essential to our healthcare system. Without them, people in crisis lose access to the care that they need. It shouldn't take a person's death, like in Hamilton, for the government to start taking these shortages seriously. What will the government do to ensure that there are no more code reds in Waterloo Region?
Thank you. Deputy Premier.
Minister of Health and Long-Term Care.
Minister of Health, Long-Term Care.
Well, thank you, Mr. Speaker. And I know that the 3 City of Waterloo hospitals are all participating in the dedicated offload nurses program that the ministry initiated and has been implementing for a number of years. And it provides additional resources directly to ERs through nursing support so that they can assist and expedite those offloading challenges that may take place in hospitals around the province. And so, Mr. Speaker, it's important that Ontarians understand, because this is such vital funding, that 100% of that funding to support offloading is provided by the government, is provided through the Ministry of Health. It's funded through the City. The City of Waterloo receives the funding from us, but it is 100% provided by the government, and I'm happy to talk specifically about the performance of Waterloo in the supplementary.
Supplementary.
Thank you very much. Ambulance response times have slightly improved in Waterloo Region, but increasingly these calls are taking longer because of offloading delays at the local hospitals. The average for ambulance days lost to offload delays has increased by 167% compared to October 2016. The Waterloo Region Paramedic Services has asked the government to provide enhanced funding for offload nurses in the region. According to their interim report, provincial funding for the offload nurse program has not kept pace with the increase in patient volumes and, in fact, has marginally decreased. Ontario families deserve more than an underfunded healthcare system that lurches from crisis to crisis. Will the government commit today to provide Waterloo Region with the funding that they need for the dedicated offload nurses?
Thank you. Minister.
Well, Mr. Speaker, our funding for offload nurses province-wide has increased actually by 64% since 2011 and 12. So in the last 5 years, Mr. Speaker, a 64% increase. But I think it's important that those who rely on the Waterloo hospitals understand that those 3 hospitals in the City of Waterloo have above-average provincial emergency department patient flow and above-average provincial ambulance patient flow, resulting in higher ambulance offload times. In fact, the ambulance offload time ranking of hospitals based on a 90th percentile from highest to lowest, the Grand River Hospital and the Cambridge Memorial Hospital are ranked 12th and 17th respectively, out of 123 EDs in Ontario. So I want to congratulate the hospitals in the City of Waterloo, because notwithstanding the argument made by the member opposite, they are performing exceedingly well, and we're remunerating them directly to do that.
Thank you.